As an audiologist at Bluegrass Hearing Clinic, I tend to see a variety of different people with different listening and hearing needs. A common issue for people with hearing loss is someone who has had cancer and if they have had chemotherapy treatment. Chemotherapy can often be ototoxic to our ears, which can cause damage to the hair cells in our inner ear and sometimes can cause damage to the auditory nerve. There are some chemotherapy drugs that can be more toxic than others. Sometimes it can cause a temporary hearing loss while you're in treatment, and sometimes it's a permanent hearing loss. Some of the reasons that it might cause more hearing loss for one person versus another is the dosage level and the duration of treatment. Oftentimes, radiation to the head and neck region can also cause damage to the hearing system, both to the sensory cells in our inner ear or sometimes just to the middle ear structures that can cause damage to the transmission of how sound makes it to our ear. And then finally, some cancers might be, depending on where the cancer is located, there could be a potential tumor that's pressing on the auditory nerve. So even if there's no chemotherapy or radiation, sometimes the actual tumor can affect the auditory nerve, which can then lead to hearing loss or balance issues. Getting hearing checked and monitored regularly is important, especially if you are on any kind of cancer treatment journey. We want to get a baseline test so that we can try to determine if your treatment is going to impact your hearing and how much it is, so that the treatment plan could potentially be changed if needed. If you'd like to make an appointment with any of our locations, you can reach out to us on our website at bluegrasshearing.com.
Ask an Audiologist is brought to you by Bluegrass Hearing.